Good evening, everyone. It's a pleasure to have you joining us for this town hall tonight. We want to update you on the progress made and the questions that you've submitted. We will answer to the best of our ability. We're excited about returning for the fall semester, and there are tremendous planning and assessment efforts going on. We are excited to have really the best plan in America for the finest instruction on the safest campus. Our infectious disease, public health, academic, and IT experts are helping us prepare to bring our students back to campus and our employees fully back to campus. We've done a lot of planning and preparation. We have some excellent training tools for social distancing, face mask wearing, and safety procedures that will keep all of our UAB community safe. Our faculty have developed a cutting-edge health check monitoring digital tool, which will allow us to monitor the health and safety of our students and employees on a daily basis. Every student will have free COVID-19 to 2 weeks for campus. We're doing that in partnership with the state of Alabama, the Alabama Department of Public Health, and the governor's office, and CARES funding is helping pay for that so that it's free to all of our students. We also are going to make that available to other public college and university students across the state. Our student health center, as you will hear, is very well prepared, and we are well prepared for really pretty much anything that might happen as we come back to campus. We will have a campus incident command center, which will monitor the safety of all of our employees and students. If not just daily, it'll probably be hourly. So great plan in place. Our hybrid learning model will ensure that everyone gets world-class education. And you'll hear more about that from Dr. Benoit and others. But we have employed the latest equipment and technology to make sure that you can receive your instruction in the class or online. We've measured and assessed all of our classrooms for social distancing, and we're working out the logistics to make sure that all of our class schedules work well for the fall. You should know that a dedicated group of faculty and staff and leaders have prepared and trying to turn over every stone to make sure that we do have the safest classrooms and the safest campus in America and continue to receive a world-class education for our returning students. We will try to address many of the questions with our comments over the next few minutes, but we will allow the last half an hour for questions and answers. You might hear the thunder in the background. There is a thunderstorm going over. So please, we hope we'll all keep our connectivity and our electricity. Let me turn it over to Dr. Benoit, please.
Try it again. Good evening. It's really nice to see so many people participating and wanting to have more information about the plans for the fall. I'm the provost for UAB and handle academic matters. So I thought, given the questions that have come in ahead of time, that I might spend a little bit of time talking about what classes will look like in the fall. There are actually 4 kinds of classes in terms of delivery method that you could be experiencing. One is that there will be some in-person, face-to-face classes. These are typically courses that are discussion sections, or they might be labs, or performance-based courses that are small in size where we can socially distance and allow for a safe quality education. Secondly, there are hybrid courses, and a hybrid course, I know there have been some questions about what does that mean. And what it means is that a course will have a combination of in-person instruction as well as remote instruction. And so, for example, if you're taking a Tuesday, Thursday class, they would alternate. On Tuesday, you might be in class, and half of the class will be in that class remotely. And on Thursday, it switches around and the other half comes to class in the location on campus, and you might be in the remote location at that point in time. So we're exploring very creative options to make sure, particularly to socially distance students within the classroom. Having half of those students in the classroom at a time allows us to be able to accomplish that in many of our classrooms. And in fact, we anticipate that a significant number of the classes will be in this hybrid format. A third possibility is remote instruction, and this is where a course is entirely delivered remotely. These are typically going to be classes, for example, that might be large lecture courses where we can't appropriately social distance. Usually a remote class is very synchronous, meaning at the same time, all the students and the instructor are available and hearing the information. And then the last option is online. And online courses are known as Q courses. Some of you may have registered for some of those in the past. These are courses that were designed to be entirely online, and they tend to be primarily asynchronous so that you are not necessarily in the same location, same place at the same time. And so those four options give us a lot of flexibility in order to continue to deliver really great instruction for you in the fall. And we're so looking forward to being able to do that. I'm going to pass the baton over to Dr. Faircloth from the Student Health Center next.
Thank you. Welcome, UAB students and parents. I'm Mike Faircloth, the Medical and Lab Director and a physician within UAB Student Health Services. I am honored to be one of the trusted voices for the health and safety of you, our UAB students, and also understand the unique privilege to provide care for you as well. I'm fortunate to have been asked to participate on and continue to serve several health and safety task forces and committees, both at the UA system and UAB campus levels. The mandates from UA system Chancellor Finus St. John and UAB President Ray Watts to set the standard for health and safety, and from Dr. Selwyn Vickers, Senior Vice President for Medicine and Dean of the School of Medicine at UAB, to develop a plan grounded in evidence-based science and medicine, have informed the decision-making and recommendations at every step of the process. SARS-CoV-2, the virus that causes COVID-19, is a new virus, but the public health principles that define how a community and individuals can most effectively respond to this challenge are not new. They are time-honored and grounded in that evidence base mentioned above. The resulting recommendations and plans align with these principles and apply to all students, faculty, and staff to facilitate a safe return to campus. These include required education about COVID-19 and the required protocols implemented, and initial and ongoing symptom and exposure monitoring, voluntary Sentinel Testing, which is a systematic random testing of a certain percentage of all on-campus students and staff on a weekly basis, both to define the background asymptomatic positivity rate for COVID and to help identify early trends and other data related to the virus, allowing more prompt actions as appropriate, and to perform re-entry testing as mentioned prior to return to campus for all students who will be on campus for any period of time this fall. Some of the basic critical mitigation measures and requirements are the social physical distancing, masking, proper hand hygiene, and remaining off campus if you're ill, and identifying those who are ill, positive for COVID-19, or who have significant exposures, and quickly isolating or quarantining to prevent spread of the virus. Again, these are sound public health principles, and when followed diligently, as is required and expected on the UAB campus, they are effective measures to mitigate exposure to and a potential illness from COVID-19. The pandemic is fluid and knowledge is rapidly evolving, and as the return to campus plans need refining and updating, this will be accomplished in a timely and effective manner. There is no such thing as no or zero risk, but with these outlined protocols and the planning, the UAB campus is absolutely actively working to provide the safest campus in America. Student Health Services is open to serve all of our students, both on site, in person, and virtually. You can make your virtual appointments online through the patient portal. We're intimately involved in all of these protocols and planning, and we will continue to be available throughout this challenging time to serve you however you might need. Thank you so much. I will pass this to Mark Booker from Housing.
Thanks, Dr. Faircloth. Good evening, Blazers and families. We are working earnestly to prepare for your return in August. As I run through the summary of efforts and plans for the fall, please keep in mind that student safety and well-being is our top priority, and that some changes in behaviors, procedures, and expectations are necessary in order for us to accomplish this. We plan to have full occupancy in the residence halls. Students will be required to wear face masks, participate in testing, health checks, and other safety measures and training to reduce the risk of exposure and spread on campus. We will not open residence halls to outside guests or other visitors. All halls will be thoroughly cleaned and sanitized before we reopen, and we will have an entire hall designated for quarantine and isolation. Move-in will take place over 5 days in August, from the 19th through the 23rd. So the days of the big move-in with all of the volunteers and all of the hustle and bustle are likely not going to happen this year. More details will follow with specifics, and you will be allowed to pick a time on those days to bring your gear to campus. So please begin making plans now to bring a limited amount of your belongings when you come in the fall. We are also going to be adjusting our rates for housing in coordination with the reduced fall semester, and more details will follow about those rates soon as well. We will begin sharing room and roommate assignments the 3rd week of July, so just a few weeks from today. If you have questions or concerns, please email us directly at studenthousing@uab.edu. With our campus dining program, we're in the process of reviewing and modifying rates for fall meal plans. We anticipate having most of our food venues open, but final decisions are still being made with regard to which venues will be open. We are going to do our best to provide safe and quick service, and will require students to wear face masks, remain socially distanced, and plan their meals around their schedules to spread out our peak demand times throughout the day. We will provide touchless payment options with all card currency as we are going cashless for the fall. We're also working on a plan to extend contact-free pickup and delivery at all locations. If you have questions regarding dining or concerns, please contact us at uabdining@uab.edu. Have a safe and healthy summer. Go Blazers. And now I'll turn it over to Dr. Stowe.
Hello, Blazer family. I hope you all are staying well and staying safe and taking good care of yourselves as we're all making preparations to be back on campus this fall. As we've been making lots of plans, protocols, procedures, and preparations for your physical return, we're also really thinking about the whole person return and your emotional and mental well-being as well. So I want to make sure that you all know that our services are available and we are fully open, providing all of our range of services that we always do. We can go to the next slide. We're offering distance counseling appointments. We're open from 8 to 5, Monday through Friday during business hours, and you can book your counseling appointment online by going to our website and web booking through the patient portal. Go to the next slide. We also want to make sure that if you do find yourself or someone that you care about in an emergency or crisis situation, that there are several different crisis options that are available 24/7 through the National Crisis Text Line, through the Suicide Prevention National Hotline, as well as a COVID-19 hotline. There are some really important free online resources that I encourage you to take a look at. The TAL platform is available for self-help if you're feeling overwhelmed, if you're feeling stressed and you want to work on some things on your own because you aren't able to participate in counseling right now. You can go to our website and enroll in the TAL platform. We also have a new platform that's called Cognito. This is an online simulation-based training tool that you can take to learn how to recognize if someone might have mental health concerns, what to do to help them, and which resources to connect someone with. So this is a great way to know how to help a friend as you think about coming back to campus this fall. Next slide. We also want to make sure that we stay connected with you and you have ways to stay connected with each other. So there are 3 things I want to make sure you know about. The Mental Health Ambassadors is a group of students on campus out of the Honors College who are creating daily virtual events that you can take part in each day of the week. There's also an active social media platform and then a YouTube channel that has a lot of the videos from the different virtual events that have been hosted. Student Counseling Services has a new podcast. It's called Let's Talk About It with Student Counseling Services that's hosted by Herbert Wilkerson, and that podcast drops every Tuesday at 4:30, and Herbert talks with different folks on campus about how to cope during COVID-19 and during this very unique time. And the third resource is our social media platforms, and we encourage you to follow us on Instagram and Facebook. Next slide. Finally, I just want to make sure that I remind you to take care of yourself and that you're vigilant about your self-care right now. Setting a routine that includes breaks and boundaries is really important to take care of yourself, but also remembering to be kind. Be kind to yourself and be kind to each other. We're all doing the best that we can. Practice self-compassion. And then be mindful of sleep, nutrition, and movement, but be gentle on yourself if you're not eating the way you think you should or exercising the way you think you should. Do the best that you can. And then remember to do something. Get creative, get learning, get serving, and get connecting with each other. And just remember, we are in this together, and we look forward to being back with each other this fall. Thank you.
All right, thank you for your updates, Dr. Stowe. Good evening, everyone. My name is Tyler Huang, and I currently serve as the student body president of the Undergraduate Student Government Association. Over these past few months, I've utilized this opportunity to communicate with many of the administrators on this call, constantly addressing your concerns and advocating for the students of UAB. Now, as a student myself, I have many of the same concerns that you all have expressed. All these complex questions rightfully beg their answers, but more importantly, they need student perspectives to make a proper evaluation. What I've been able to do is weigh into these topics and provide input directly from the undergraduate student body. And while I understand many of these struggles, I have limitations in amplifying every concern. So I intend to address many of the common themes and enact for change that UAB students hope to see. Some things that USGA has been working on over the past few months include continuing to promote and reach out to students for the SGA COVID-19 emergency grant, which has provided substantial monetary support to our students with the help of countless donors. My executive team and I routinely serve on various task force and committees evaluating scenarios for reentry and adapting plans to best fit the needs of our students. Specifically, I serve as a student representative on the UAB Transition Task Force Committee, which has routinely met since March. So this has been an ongoing conversation. And UAB leadership has been phenomenal in including student input. Our most current project consists of partnering with Student Affairs to sponsor and provide face masks for every student on our campus. We will strongly pursue this initiative to ensure the safety of our students upon our return. Outside the direct scope of COVID-19, USGA will continue to utilize our platform to stand up to the various injustices that continue to plague our society. Additionally, we will advocate for more accessible educational opportunities through our textbook scholarship program and unite with our student organizations on campus to encourage an adjusted but the same tradition of Blazer community to support emotional and mental well-being through campus involvement. Overall, the support and transparency that I have been provided from administrators demonstrates the values that UAB upholds in assisting their students. I found a deep appreciation for my inclusion in many critical conversations as students, faculty, and administrators unite toward a common cause. While we discuss the topic of unity in our community, USGA is proud to support #UABUnited, but we need your support and accountability more than ever as we continue to plan for the safe reentry of every student on our campus. Your concerns have been made aware to USGA. However, we gladly welcome more questions, suggestions, and innovative ideas to enhance the student experience. Please don't hesitate to continue to reach out to us and be sure to stay updated with us on our social media for any updates. Thank you.
Great, thank you, Tyler. Hi, everyone. My name is Rosie O'Byrne, and I'm going to help moderate the remainder of the town hall, which is going to be Q&A, and your questions have been coming in. So many of your questions hit similar themes, so I'm going to try to compile some of that. So first question, a student says, I'm currently a UAB student, wanted to know, is there an option to take classes that you've registered for online if you do not feel fully comfortable attending in-person classes in August? So I will ask Dr. Benoit.
So there, as I said earlier, there are multiple options. There are remote courses. There are also online courses. If you have a medical reason that you cannot be in class, then we would encourage you to reach out to Disability Services. I see Allison Solomon is on the call too. And I would also suggest that you look in the schedule to see how classes are being offered. Particularly for some classes, it's very difficult to offer them entirely remote or online. For example, classes that have labs, although we've been very creative about different kinds of options that are available. So look in the schedule. We're currently working with each one of the schools and hope to have the schedules up fairly soon to try to let you know how each class will be offered in the fall semester.
Thank you. Since you mentioned DSS, another student asked, since we are having hybrid classes, how will DSS accommodations for classes be affected? So Allison, if you'd like to jump in.
Sure, good evening. I'm happy to answer that. One of the things that's important we want students to know, especially students that are already registered with Disability Support Services, as well as any students that think they need to register with DSS, the process for receiving accommodations will be the same. So if you're registered with DSS, our system is set up so that you receive accommodation letters by using the portal. And so that will work the same, the way that it worked in the spring and the way that it's worked in the summer for those that have taken classes this summer. So you're going to follow that same process. If there's specific questions, we would definitely encourage you to contact us at dss@uab.edu. But we'll take a moment to share a little more. Dr. Benoit had referred to if you had a medical condition that may need accommodations. One of the things we want to make sure that students are aware of is that we are in the process right now of creating a process that's going to be added to the Disability Support Services webpage. Our goal is by Friday to have it on there, but there is going to be an application process for students who, if you have a COVID-19 positive result. So if you have COVID, for students that are categorized in that higher risk, as the CDC has outlined, if you live with someone who is impacted by COVID in that way, we're happy to work with you, and DSS will be happy to answer any questions that you have related to that. So we would just encourage you to contact DSS directly if you're impacted by COVID in terms of your medical condition. Thank you.
Great. Several questions related to parking. Will parking prices be decreased since we won't be on campus all of the time? So I think maybe Alan Bolton, if he's here. Yeah.
Hey,
This is
Rosie.
Andre's here.
Yeah.
This is Andre. I can take that one. We actually set our parking rates back in March pre-COVID-19. But as a result of COVID-19, we have reevaluated those rates. And yes, our parking rates have been discounted as a result of the condensed class schedule for the fall. The new parking rates were just loaded on our website today, so that when permits go on sale Wednesday, July 1st at 12 a.m., students will see the new discounted parking rate on the website and in the ordering portal.
Great, thank you.
Rosie, could I jump in just a minute and talk about the calendar? There have been several references to it, but we haven't explicitly talked about what the calendar looks like in the fall. There have been some messages sent out about this. If you haven't seen those, let me remind you that we are planning to start on August 24th, which was the original start date. We are planning at Thanksgiving break to ask students to go remotely for the last week of classes and then the week of final exams. And the reasoning behind this is that this then allows us not to have students travel and come back from a variety of different locations and back to the campus, and potentially increasing the spread of COVID by doing so. So we're trying to be very conservative, but still provide a lot of quality experiences before they go, and continued in a remote format after Thanksgiving. So that's the schedule for the fall. And then again, coming back in January for the following term.
Great, thank you. And Andrea, a follow-up question. What changes will be made to the Blazer bus system and the late night escort services to ensure the safety of passengers?
Great question. Providing a safe environment for our passengers is the most important concern of ours. So we've implemented a number of changes with Blazer Express with regard to safety, a few of which include, as you heard Mr. Booker state, face coverings will be required for all passengers on Blazer Express. This includes our bus drivers as well. We are also limiting the number of passengers on Blazer Express buses and on our safety escort vans to promote and support social distancing. We have also, again, enhanced our cleaning protocol daily, nightly, and also weekly. And be sure to visit our website in the near future, because we'll be posting an article on some of the new enhancements we're doing with that.
Great, thank you. A lot of people are asking about housing assignments. So Mark, I'll let you take that one. When will they see housing assignments come out?
The third week of July, we will begin sending those out, and part of that is due to a little bit of a delay in determining what the best course of action would be. So we're a little behind where we normally would be, but it will begin the third week of July and occur over the next 10 days, more than likely. And again, once you get an assignment, if you have questions or concerns, please reach out to us and we'll address and handle those as soon as we can.
Great. We have another question. I think Dr. Watts answered this at the beginning, but I know that we had a little bit of, you had a little bit of a storm behind you, so it's worth repeating. Several people want to know about COVID-19 testing. Will UAB provide COVID-19 testings, and will students have to pay for testing? You're muted, Dr. Watts.
Thank you. Yes, we will provide free testing to every student, new and returning, prior to coming back to campus. And most likely, it will be in the 7 to 14 day period before the return. And with that testing and a negative test, along with completing the appropriate safety training and enrolling in the health check, then students can come back to campus. And as was mentioned earlier, there will be what is called Sentinel Testing for our employees and our students. It's a randomized testing of a certain percentage of students using public health and epidemiologic principles to be able to predict how the virus is behaving in our community, and in particular, if there are areas that we really need to focus attention on. So yes, that test will be free. That's being funded by the CARES Act money that came from the federal government to the state of Alabama, the governor's office and the Department of Health for the state of Alabama. We are working with them to provide that to our campus, to our sister campuses at UA and UAH, and we actually are, through the state, going to make this available to all returning college and university students in the state of Alabama, which is over 250,000 plus. So this is a very comprehensive plan. Fortunately, at UAB, we've got the medical and public health, information technology, digital firepower to be able to pull this off on behalf of all students in the state of Alabama.
And maybe a follow-up question for you or Dr. Benoit. How will UAB enforce mask regulations and social distancing?
Well, it's important to understand that the reason to wear a mask or face covering is both to protect yourself, but also importantly, to protect everyone around you. The most powerful tools right now to fight COVID-19 are mask coverings, good hygiene, and social distancing. If you are outside the range of 6 feet and you have mask coverings, you have a very markedly reduced likelihood to develop COVID or to get COVID from someone. The reason for hand washing is because you might touch a doorknob or a door, etc. So we have enhanced hygienic cleaning, and we know that if you wash your hands frequently, especially after touching anything, then you will remove the COVID from your body. So we're going to do everything possible to make sure that all of our students and all of our employees and our entire community are safe and get the very best that science, medicine, and public health can offer.
Great. Dr. Benoit, do you want to add anything there?
I would also add that in the training that each one of the students will come through, it details the importance of mask wearing for each one of the classes, and even when you're outside of class, to continue to wear your mask. And that faculty will be able to tell students that they cannot come to class if they're not wearing their mask. It's incredible, as Dr. Watt said, it's incredibly important. This is the way that we will be able to continue to provide some in-person experiences for students. And so we need your help in making sure that we're keeping others safe as you come back to campus.
And I would add that it's important to understand that this is what our healthcare experts do every day in our clinical facilities, in our hospital, our clinics, etc. And so this practice will keep the entire UAB community safe. If you're not wearing a mask, you will not be allowed to come into a classroom. And you will not be allowed to be in an experience with other students and faculty unless you are wearing a mask. So that's how important it is. And we really believe that if our students understand this and accept the social responsibility of taking care and looking out for one another, that we will have the compliance that is necessary.
Great. Dr. Faircloth, someone is asking about, could you clarify the type of test that students are going to be expected for the COVID-19 test?
So for the screening, which would be the mass universal screening or the Sentinel testing, it's likely to be a nasal swab. It's different than the NP swab used for those who have illness or symptoms and are getting tested that are symptomatic, where you go all the way back to the back of the nose to the nasopharynx, almost to the tonsils, and can be somewhat uncomfortable. This is both nostrils in the very front. It's self-administered with a healthcare provider watching you do it. It's very simple and it's painless. So it's much different than what some folks have experienced when getting tested if they had illness, for instance.
Great, thank you. I think this one would be for Mark Booker. For the residence halls like Camp Hall and Blazer Hall, is there going to be one person per dorm room?
No, the plan will be to have full occupancy. So there will be, for those rooms designed for two, there will be 2 persons in each room.
Great. And then I think this is probably for you, Greg Parsons. Will campus buildings like the rec center, the library, and student center be open?
Yes, the social distancing will still be practiced. The libraries will still be open. We'll designate seating in such arrangements that they can use the accommodations of the library at a safe distance. And we'll continue to clean those facilities as we do others.
Did anyone in student affairs, Dr. Kennedy, did you want to weigh in on rec center or anything? Let's see.
We haven't determined yet exactly when the rec center will open, but we are going to work as quickly as we can to do that safely. As soon as the folks, the experts let us know that it is safe for us to go ahead and do that in a socially distanced way, then we will get that set up and squared away. We'll certainly communicate with members and our students as soon as we have a plan for that.
Great, thank you. An individual asked, will tuition still be the same price if some classes have moved to online? I ask this as we will not be using all the campus resources. So either Alan or Dr. Benoit.
So there's a distinction between remote courses and online courses. online courses are the Q courses. Those were designed to be offered online, and the pricing reflects, it's storming. The pricing reflects the pricing reflects the course, that it's an asynchronous kind of delivery. Remote courses, if you happen to have a remote course, will be offered at the regular rate, just as we did in the spring. I would also comment about the resources. Actually, there are an incredible amount of resources going into converting courses to either a remote or a hybrid format. And so it is quite expensive for us to do this. We're also installing cameras into the classroom so that if you are in the section at this point in time where you're not in class, you still can see the instructor and interact with the instructor and participate in the conversation. So there's a lot of additional expenses to being able to continue to offer instruction in this way.
If I can also add, I will remind the folks on the call that we recommended and our Board of Trustees approved no increase in tuition. So tuition rates for both in-state and out-of-state students will remain flat, the same as they were for the last academic year.
Thank you for that addition, Alan. That's very important.
Thank you. Dr. Wallace, a lot of students are asking about student organizations. How will that work this fall? We might have.
I'm having a few technical difficulties. Okay. Was the question about student organizations?
Yes, and how they'll operate this fall.
So we are working on a plan right now to communicate with our registered student organizations a way in which they can either program virtually or keep the tenets and parameters we have for social distancing to include the 6 feet of distance between all participants, making sure that all events are registered through Engage, following the facility guidelines that will be put out there for each facility, and keeping indoor events to 10 or less participants. We really expect that most things for registered student organizations will still be virtual, much like we are doing with our departments through the Division of Student Affairs to offer services and programming virtually for the fall semester. But we'll be working with you through the Office of Student Involvement and Leadership.
Great, thank you. A couple more for Mr. Booker about housing. When it says no visitation, does it mean not even UAB students can visit each other in their dorm rooms, or does it mean no non-UAB people can visit?
I think initially we're going to limit it to no outside visitors. So if you are, even if you're a UAB student and live in another residence hall, we're going to ask students to stay in their assigned hall versus visiting one another, again, just to do everything we can to minimize the spread. As the semester goes forward and we get into the spring maybe, then we can reevaluate that practice. But certainly no outside visitors, and we will more than likely also restrict our UAB students visiting as well. Good question.
And then just a follow-up for you, Mark. How do you plan to maintain social distancing? Like, what are the rules for social distancing within the commons and other places for eating?
Sure. Another good question. We're going to reduce the amount of furniture in most of our areas where students congregate. That will include the dining locations, the lobbies, the lounges within the residence halls. We really want students to adhere to our guideline of no more than 10 students in a gathering at one time. In addition to that, we're also going to be, as we've discussed a couple of times, enforcing wearing face masks. If you're in line for dining, remaining 6 feet apart while you're waiting on food, where there will be no self-service of food. So all food will be prepared behind the station. And then grab and go will also be another option, so that if there aren't tables available, you can grab your stuff and leave the Hill Center or the Commons and eat on the green and enjoy some fresh air.
Great, thank you. For Dr. Benoit, perhaps, for the mixed online live classes, how is it going to be decided which students will be in the online session versus the live days? Will it be possible for students to express preference based on their schedules?
Okay, so this would not be online. It would be either a combination of in-person and remote instruction. Remote, remember, is really focusing more on synchronous kinds of learning as opposed to online, which focuses on asynchronous learning. And we are continuing to work out the process for identifying which students will be on campus on which days. What we're trying to do here is to limit the number of in-person exposure hours any given student has. And so we're trying to work through that process currently.
And then we have a parent asking that their daughter is out of state. When classes go online, will the out-of-state students get the online rate instead of out-of-state tuition rate?
They will continue to pay the out-of-state tuition rate. An online rate, if it's an online course, will be charged. If it's at a remote course, then they would pay the out-of-state rate for regular courses. And again, I've answered this question a couple times with other individuals. It's a really good question, and I'm not surprised that it gets asked a lot. This is the issue about out-of-state students paying an increased tuition rate, and that's done not because of the delivery format, but it's done because out-of-state students and their parents do not pay state taxes within Alabama. And those state taxes help to support the courses that we're able to offer. So this is a way of compensating for that.
And I think you've answered parts of this question, but a couple of people have followed up. People want to know, how will students exactly know which type of class they are registered for, hybrid, remote, etc.?
So currently we're gathering that information from each one of the deans for each of the schools that you might be taking classes in, and that will appear on the schedule when we have a chance to load it. So we're hoping by the end of this week we'll have all that data in, and then we'll start the process of identifying, is it a face-to-face class? Is it a hybrid class? Is it a remote class? Online classes are already identified in the schedule because they carry the Q designation. So if you've registered for one of those, you already know what kind of class that will be, but we'll be modifying the schedule to reflect that information. I'll also say one of the things that we've needed to do is, in some cases, the classroom that a course was originally scheduled for can't accommodate the number of students that are in that class and do it in a socially distant way that's safe. And so there will be some location changes as well, and that will also appear on the schedule as we do these modifications. So we're trying to provide as much information to you so that you can look and see what kind of course each one of these classes will end up being.
Great. We've had a couple of questions about athletics. Do we have anybody from athletics in the room?
And
yes, I'm on here.
Will athletics be making announcements soon on how student athletes will be impacted? And then maybe
Yes.
weigh in on what's going on in athletics in general.
No, we definitely have everything already in place. Many of our football student athletes have already returned to campus and have been working out in the weight room. July 15th, they will start actual fall practice and workout sessions at that time. So that is already in place. We had a testing policy as soon as those student athletes returned to campus, where they all were tested immediately and quarantined until we found out what their positive or not positive negative tests were. At that time, if they cleared, then they were able to start working out. And so all those things have been in place. As far as it goes for our facilities come fall, we are optimistic that we will be playing this fall at Legion Field, our home football games. We have already put together a model of social distancing at the ball games. We'll be working with the city of Birmingham, the university, state of Alabama, and obviously the NCAA to follow what practices and what regulations that we'll need to follow at that point. But we already have the model in place to make sure everybody is properly social distanced, masks being worn, all the same things we've talked about so far on this video will already be in place for our games as well. So everything from that standpoint is moving forward until we hear otherwise, but we're still exactly 2 months before kickoff. So at that time, we'll have a better idea of where everything stands and looks. So it's a fluid situation as we move.
Great, thank you. Greg, this might be a question for you. Several people want to know, could you explain the protocol of how classrooms and common areas will be cleaned? Maybe more specifically.
Right. The emphasis we will be placing is on those commonly touched items that have been referred to: doorknobs, restrooms, commonly touched surfaces where hand-to-hand transmission could occur. We also intend to provide hand sanitizer, wiping and spray disinfectant in the rooms. We have some large-scale, heavy-duty cleaning apparatus that we'll use a couple of times a day in the classrooms. But just due to the current class schedule and number of people will be what we're referring to as wipe in, wipe out. You clean your desk and workstation as you go in, and you clean it as you leave. So we're going to provide the supplies to make that available to everyone. And then we'll also add additional cleaning regimen between.
Great, thank you. Another residence hall question, Mark. So will students remove all of their dorm belongings in November, or can they stay put for the January return?
Well, again, everybody's sort of been through this, especially our returning students. Our advice is going to be to go ahead and take as much stuff with you as possible, just in case something happens between November 20th and January the 8th, when we would reopen the halls for spring. Everybody keeps saying the word fluid. It's a fluid situation. It's unprecedented. No one knows. So we're trying to limit the amount of belongings that students bring to facilitate an easy and quick and careful move-in process. And then hopefully, if you choose to take your things with you when you leave, you can get everything in one car, and it'll be a little bit easier to leave when you do go home. But it's not required.
Thank you. This question may be for Dr. Benoit or Dr. McMahon. Do you plan to alert students about other students and faculty who test positive? Maybe Dr. Faircloth.
I don't know who wants to jump in here. We have an exposure notification piece of software that we have developed and will be rolled out, we hope, the end of July. And what happens there is that someone indicates that they have a positive result, and that software allows us to see who they've been in contact with. Because of HIPAA regulations, we would never identify the individual student. There are privacy issues that are involved there. Dr. Faircloth, would you add more to that answer?
Yeah, I would just reiterate, with FERPA and HIPAA, we would never identify positive individuals to other individuals like that.
Let me just elaborate. What that software tool does is in 6 feet of someone for 15 minutes or more who is tested positive for COVID. It will alert you that you have been in that proximity. And then there's a medical protocol for how you take the next steps and contact student health and either get testing or quarantine until you know that you don't have the COVID-19. But it's very rigorous, very well thought out, and it's something that we believe will give our students and our community a great advantage in limiting the spread of this virus.
Thank you. Dr. Barnes, several questions about first-time enrolling freshmen. Maybe you could provide more information there. Is there specific or separate instructions for first-time enrolling freshmen?
In regards to what, deferring a scholarship, or?
Well, just is there specific information related to them that they should know?
Yeah, we actually plan to host an incoming student town hall on July the 8th. I would encourage everyone who's an incoming freshman and their parents to attend. We'll have similar information to provide. but maybe a little bit different that may focus on scholarships and financial aid and things like that too.
Thank you. There's a few other questions about testing and for students who are out of state, and I'm thinking maybe Dr. McMahon is the best person. You've been in a lot of those meetings about testing. Maybe you could provide some more up-to-date information about students who are out of state and how they would get tested before coming to campus.
Yeah, so we have a lot of discussions going on right now and a lot of planning to be able to make COVID testing accessible to not only our in-state students, but out-of-state students. So UAB and the governor's office have several partners who are helping with this. And so we're working with those partners to make those locations available. And so one idea, and this hasn't been decided yet, but one potential partner is a Walgreens or a CVS, something like that. So out-of-state students might be able to go to a local Walgreens to get testing. But again, these conversations are still ongoing. We haven't decided all of this for certain, but those of you who live outside of Alabama, we will communicate with you and let you know where you can go locally to get your test taken. And the time frame is 7 to 14 days prior to you coming to our campus. So that will also be communicated to you as soon as we know the specifics.
Many students are asking if that's required, if UAB is kind of mandating the test.
Yes. Yes, you heard that from me. I'm from President Watts. So all students will be required to take a COVID-19 test before they come to our campus. And so we are anxious to get all those plans in place, and we will let you know how that will work for you based on where you live, whether it's in the state of Alabama or outside Alabama.
Okay. And then students are asking about Sentinel testing. Is Sentinel testing required?
I can answer that too, but Dr. Faircloth may want to join in. So Sentinel testing will be across our campus, so students, faculty, and staff. So somewhere between 2.5 to 3% of our population will be invited to participate in Sentinel testing. It is a voluntary test, but we hope that everyone who is asked to participate will participate. This is one of the great measures that we are putting in place at UAB to keep all of us safe. So if you are contacted and asked to participate in Sentinel testing, we hope that you participate and that you say yes. Dr. Faircloth, do you want to add?
Yes, it is voluntary, but as you pointed out, it's a great way to notice trends and groupings and things like that, so we can act early and decision make very early in the process. So it is voluntary, but we really recommend participating if you're chosen.
Great. And this question is for you, Allison Solomon. Someone's asking how to qualify for DSS. What kind of documentation do they need to provide for high risk for us or family members?
Right. So that's one of the things that we're in the process of developing right now that will actually be posted. Like I said, our goal is to have that posted on our website on this Friday is the goal. And so one of the things that will be on the website is indicating specifically, depending the category that you fall into, what you will be required to provide to disability support services to coordinate these accommodations. And so again, I would stress, please contact DSS specifically regarding your situation. We'll be happy to answer your questions.
Okay. And then some more housing questions. Mark, you're popular.
That's okay.
In the housing email sent out recently, we were told we could bring limited personal items. What does this mean if we are going to be taking some classes online, thus spending lots of time in the dorm? Shouldn't we be able to make it feel home?
Sure, absolutely. And it is your home, and we want you to feel at home. Again, the guideline is more a general rule of thumb to promote an ability that in the event the circumstances change or you decide to leave on the 20th in November and take some of your gear with you, that it's just easier for you to do that. So it's just a planning tool to try to help students plan ahead. Again, knowing that not every student on our Zoom tonight is going to be living on campus, just stay tuned for what those specific recommendations will be. I won't bore all of our audience members with an exhaustive list, but we will be giving guidelines in the very near future.
Then Dr. Benoit, you probably can answer this question. Will PPE be provided to students from UAB?
Each student will receive 2 masks as they come into campus so that they will have access to the necessary PPE and be able to be compliant with the mask requirement for campus.
I think you might clarify that those would be cloth masks.
Yes.
That are washable, so that each day you would wear one that is clean, wash the other, and be prepared for the next day. And there will be additional face mask and other PPE in various locations in case somebody forgot theirs that day, etc.
Right.
And as a follow-up, will there be hand sanitizer dispensers available throughout campus?
Yes.
Great. All right. So somebody's asking about sports. Well, we have sports. I think that's been answered to some degree, but if anybody else wanted to weigh in on athletics or intramural.
We are planning to do our very best to have our athletic teams participate in competition. And it's going to take a lot of diligence and a lot of planning and a lot of discipline. But we believe that if we do everything possible and everyone follows the appropriate guidelines, we hope that we can have complete seasons this fall for all of our teams that participate.
Great. So we're about close to 7 o'clock. So I want to give just some time for some closing remarks. Dr. Benoit and then Dr. Watts. So Dr. Benoit, anything you want to add in closing?
So I'm encouraged to hear all the interest in your questions. I hope we've tonight been able to answer some of those for you. As you can tell from the number of people who are on this call and the answers that you've gotten, that we are planning like crazy. We want so much to have you back in the fall, and we are doing everything possible to have the safest campus in the US and to make sure that we continue to provide a great education and get you back here so that we can continue our efforts together. So thanks so much for tuning in tonight.
Dr. Watts?
I would reiterate that we do want to have your safety first and foremost, always in mind. And we want to have the safety of all of our employees and our students and our community in mind. And that's why we're going to be disciplined about compliance with these measures that we know reduce the risk for everyone. And that's why we want everyone to have a test before they come back in order to protect each other and protect our community. But we want you to know that we're using the best medical and public health and scientific information available to anybody in the world to put together a plan that is all about your safety, all about getting a great education, and all about serving our community as well and safely as possible.
Thank you. We've been recording this session. We'll post it on UAB's YouTube channel. So if you want to go back and watch it. And we also received so many questions we couldn't get to, but we will compile those. And I encourage you to check out the UAB Green Mail, and we'll have more information there. And then we have a website, uab.edu/reentry, and we will have a FAQ section on this website that we will try to address the most common questions that we received this evening. So thank you for your participation, and y'all have a good night.
Thank you. Go Blazers.
Thank you. Go Blazers.